Reshaped Health.
Did you know that there were over 250,000 nose reshaping surgeries called rhinoplasty done last year, and a quarter of them were done on men? Hi, I'm Dr. Paul Vanek, and I'm a board-certified plastic surgeon, and I'm here to help you think health. Ladies, if you're tired of hearing your man snore all night and keep you up, it might be time for you to have him see someone about a septoplasty and nose surgery for snoring. During the same surgery, snoring sufferers can have their nose reshaped to look better at the same time as it is repaired internally to make it breathe better. When I talk to my patients about rhinoplasty, I use an analogy like a car. How it looks is the outside chassis and is the shape of the nose, which is cosmetic. How it drives is how it breathes and works, and that is often covered by insurance to improve the function of the nose. Sometimes the nose is just blocked on one side, which can be corrected with a septoplasty only. Snoring arises primarily because of the crooked anatomy inside the nose and factors found in the back of the throat that include the tonsils. It is common that this problem is tackled at the same time as the nose is reshaped, and it's called a septorhinoplasty. Cosmetic rhinoplasty starts by listening to you and talking to you about your goals for reshaping of your nose, which is a very individual decision. The unique variation of your nose will be discussed in person with the simple use of a mirror, as well as using some technology called mirror imaging software, in which the image we obtain can be morphed to determine what your outcome can be. I'm here today with Kristen, who's a 28-year-old from Erie. Welcome, Kristen.
Thanks, Dr. Vanek.
Some years ago, you decided you wanted to have a rhinoplasty. How did you make that decision?
Well, I remember growing up as a small girl and always feeling like my nose didn't quite fit the rest of my face. And I made a few comments about it, and my mom and friends would tell me, don't worry, you'll grow into it. And unfortunately, that never happened. So I decided to take matters into my own hands and have it fixed.
And now that you're over 2 years after your rhinoplasty, how do you feel about your results?
The results are better than I had imagined they would be. I'm very pleased and much more confident.
Well, thank you for joining us today,
Thanks
Kristen,
for
on
having
Think
me.
Health. Are you breathing well through your nose? Rhinoplasty techniques are designed to take advantage of modifying the skin, cartilage, and bone structure of your unique situation to meet several basic goals. The incision is between the nostrils and then inside the nostrils where it is hidden. The structures of the nose can be modified based upon our surgical plan. This man could not breathe out of his nose for years after having it broken 5 times during high school sports. He straightened his own nose after several fractures on his own, but sought me out to improve his breathing and make the hump less prominent. His wife loved the idea that he snored a lot less because the septum was repaired at the same time. Shown here is his results even years later after surgery. His nose is straight and his breathing is open. This next patient wanted to improve her facial and neck contour, but has disliked the size of her nose since she was a much younger woman. The procedure of her nose was performed to reduce the tip length and height of her nose, as well as make her tip less pointed. Her breathing was also improved by the simultaneous septoplasty. So if your goal is to improve a central feature of your face with a nose reshaping, click over to my website to review some results you'll love at paulvanekmd.com. A consultation with mirror imaging can have you see if the possible results will meet your expectations. Before you have the procedure, until then, thanks for letting me help you think health.
Think Health.